Hello and welcome. Today we have prepared an informative video about anaphylaxis for you. We hope it will be useful for you. Anaphylaxis is a serious life-threatening allergic reaction condition and may require rapid intervention. This video aims to give you a general understanding of anaphylaxis and help you learn about its symptoms, causes, treatment methods, and how you can prevent it. First, we will explain what anaphylaxis is and how it occurs. Next, we will examine how an anaphylactic reaction develops in the body and what triggers can initiate it. We will also describe the symptoms of anaphylaxis and how to diagnose it. Finally, we will highlight some important points about anaphylaxis and correct common misconceptions. After watching this video, you will be more aware of anaphylaxis and better able to protect yourself and your loved ones. To learn more about anaphylaxis, we recommend that you watch the video to the end. So let's get started. Anaphylaxis is a severe systemic allergic reaction that occurs rapidly and can lead to death. The cause of death is mostly due to diagnosis, delay in treatment, incorrect treatment, or patient's unresponsiveness to treatment. Since it is a life-threatening emergency, physicians from all branches should know the signs and symptoms and perform the first intervention. Insect bites. Certain drugs or food products are among the common causes of anaphylaxis. Immunotherapy injections used for various reasons may also predispose to allergic reactions to various substances. Caution should be exercised in cases of latex hypersensitivity, which is on the rise, as anaphylactic reactions may develop. Despite all these factors, the cause of anaphylaxis may not be elucidated. In some cases, and this is called idiopathic anaphylaxis, the biological cause of anaphylaxis is an overreaction of the immune system after contact with an allergenic substance. The anaphylactic reaction can progress over time and result in the development of allergic shock. There are many allergens that can trigger this condition. Some medicines such as penicillin, insect bites, various nuts, shellfish, milk and eggs, latex. In rare cases, in addition to these factors, excessive aerobic activation resulting from exercise such as running may also trigger anaphylactic reaction. Symptoms of anaphylaxis usually appear within a few minutes after exposure to an allergen. However, in some cases they have also occurred half an hour or more after exposure. Signs and symptoms of anaphylaxis may include a rapid and weak pulse. There may also be skin reactions, including rash, hives, itching and redness or pale skin, and low blood pressure, i.e. hypotension, narrowing of the windpipe and airways in general. A swollen tongue or throat is a common symptom, and this can cause wheezing or shortness of breath. Nausea, vomiting, diarrhea, dizziness or fainting are also symptoms of an anaphylactic reaction. An anaphylactic reaction can stop breathing or heartbeat. Unfortunately, there is not yet a way to treat the underlying immune system condition that can lead to anaphylaxis. In most cases, however, it is possible to take steps to prevent a future attack and be prepared if it does occur. No matter how careful and precautionary any individual is, at some point they may be exposed to objects to which they are allergic. However, it is possible to respond quickly and effectively to this emergency by knowing the signs and symptoms of an anaphylactic reaction and preparing in advance a plan to treat these symptoms quickly. An emergency action plan prepared with the help of a doctor can help the individual in the case of anaphylaxis in children. Caregivers, school health workers, and teachers should be informed about the condition and their current plans. The plan should then be shared with these people. School authorities should ensure that an auto-injector is available. Because anaphylaxis is a life-threatening clinical emergency, treatment should be administered quickly after diagnosis. The following steps should be followed in treatment. When anaphylaxis is encountered, first of all, the person should be placed on her back with her legs above the torso level, and the airway should be kept open. Keeping the patient sitting or standing may lead to empty ventricle syndrome and death. However, pregnant women should be placed on their left side. In case of nausea or vomiting, the patient should be placed with her head turned to the side. The patient's contact with the stimulus trigger should be cut off. If it is a bee sting, the stinger should be removed without breaking. If it is food-related, The mouth should be washed and cleaned. And if it is an intravenous drug, it should be stopped immediately. The first drug that should be given in treatment is adrenaline. Adrenaline auto-injector should always be with people who have had anaphylaxis before. Oxygen should be given for support. Intravenous access should be opened and other drugs should be administered according to the symptoms and signs. After the emergency treatment of anaphylaxis is performed rapidly. Even if the symptoms and signs completely resolve, patients with respiratory complaints should be monitored for 6 to 8 hours, and patients with circulatory disorders should be monitored in a hospital environment for 12 to 24 hours due to biphasic anaphylaxis. Dear viewers, we have come to the end of another video. I hope this video about anaphylaxis was informative and useful for you. You now have a deeper understanding of anaphylaxis and know how to deal with emergencies. Anaphylaxis can be a life-threatening condition, but with the right knowledge and preparation, we can combat it. Remember, the symptoms of anaphylaxis can appear quickly and pose an immediate danger. So it is vital to recognize the symptoms and apply the right treatment. If you enjoyed the video, don't forget to like and subscribe to our channel. Also, if you would like to explore more health-related content, you can check out other videos on our YouTube channel. Thank you for watching and we wish you a healthy life. See you in the next video.